Good. Okay. Welcome to the March 2026 monthly meeting of the Georgia One Health Consortium. You should be able to see my screen. Just have a few quick announcements before we welcome our guest speaker. Just as kind of an update of where we're at in numbers, from the very first month that we started this consortium, I am so happy to say that we have steadily been growing. Some months it's like an influx, and then some is kind of like a trickle, but still moving, in a positive direction. So we're up to 153 people now, and 58 of those have signed up for a Circle account. Just as a reminder about Circle, this is our member engagement platform. It's a lot of fun. It's a kind of a social media hub for the group where you can post a lot of information, concerning events. Or this morning, because of Dr. Richmond, who's on the call today, we posted about a postdoc with USDA APHIS, so that's really cool. There's also people posting about, recent papers, manuscripts, and other opportunities. So as we build out our One Health toolbox, you'll see, announcements about that as well. So if you haven't signed up for Circle, please do so, and start contributing today. Also, our consortium website is growing, especially as it relates to all of the logos that we get to display in terms of participating organizations. So if you do not see your logo up here and you would like for it to be included on the consortium website, please send it to me and I am happy to put it up there. But we have a wide diversity of organizations that participate in the consortium, which I'm so thrilled for. That's governmental organizations, academic institutions, and NGOs as well. So really happy to see people pouring into that. I do want to say that thanks to all of our volunteers, we actually have our lead positions all filled. So Dr. Samples and Dr. Wessey are our monthly meeting co-facilitators. Janet Hendrickson, who presented last month, is our outreach and engagement coordinator. Dr. Hall from Berry College, who unfortunately can't make it this semester because of his lecture schedule, is our partnership and collaboration lead. And then also thankful for Dr. Mercer and Dr. Comfer from Georgia Southern, who are stepping in as our education and student programs lead. So this is not, a group that is, set in stone. So if there are people who want to join in on this party, you are welcome to be a part of this leadership group or volunteer group to help grow the consortium. Now, last month, I did talk about the possibility of us having another Georgia One Health symposium this year. Last year was our first year and it was wildly successful, and I'm super thankful for everybody who participated in that event. And so I've had a couple of people ask, are we having another one? And I guess if we have a second one, then maybe we can start to call it an annual event. But we're scoping out opportunities. So just as a reminder to everybody on the call, last year we received funding from the CDC through CSTE in order to build this consortium and to host a symposium. And that's why we're here today. And so just in building that momentum and getting to know more and more people across the state who's interested in One Health, we're thinking that, we're going to approach this symposium with a kind of a build it and they will come mindset. And so we're looking at dates like September 17th and 18th with a possible volunteer opportunity with the People and Pets Project on that Saturday, potentially. So just kind of throwing that out there. If you're interested in volunteering or kind of serving on that, like symposium committee, if you will, to like kind of help iron out some of the details, we would certainly love to have you. And, as we start to figure out the location and what it entails, then we'll have a better idea of kind of, what is the lowest cost option for registration and stuff like that. But the team at IHLA is pretty frugal, so we'll see what we can put together. And again, just email me if you have any ideas or want to volunteer to help put that together. So continue to spread the word about the One Health Consortium. I'm super thankful for everyone who is pouring into it and who've been with us for a long time and who's just joining us this month. Continue to sign up for circles so that you can get the latest information. And our next monthly meeting is going to be April 24th. So feel free to reach out if you have any questions or any opportunities for collaboration. So, with that said, I am so excited to introduce this month's guest speaker. Dr. Lauren Ward. She is Impact Scholar from the Center for Global Health Equity at University of Michigan. And just as a continuation of our last monthly meeting, she has worked with Janet Hendrickson from the People and Pets Project, and that's how we got connected. So, Lauren, I'm going to allow multiple participants to share. So you should be able to go ahead and share now, and I'll turn it over to you. Thank you again.
All right. Thank you for having me today. I'm very excited to be here to talk a little bit more about People and Pets work, particularly the international work that People and Pets is doing in Guatemala. So I'll talk a little bit about my research and what I do first, and then I'm an environmental health scientist, so I'll talk a little bit about how the environment fits into One Health, and then about the work that People and Pets has been doing and the research we're continuing. So I like to joke that I made sure to get in all the parts of One Health in my kind of educational background. So I started at Purdue University. I studied biology and chemistry. I worked with rats in a neuroscience lab, so I got my animal portion. I then went to New Orleans and studied for a master in public health and tropical medicine at Tulane. And then I moved up to Michigan for a PhD in environmental health and took two little detours to Copenhagen to spend summers studying One Health and global health in their global health program. A lot of my research has been based in Nepal, and so currently I'm like half in Nepal, half in Guatemala on projects. A lot of my research in Nepal has focused on measuring PFAS in a cohort of adolescents there, and also on looking at waterborne contaminants. So a lot of times when I tell people I'm an environmental health scientist, they ask what I do all day. I've also had people tell me they think I'm probably really good with plants, which is not the case. I'm actually terrible with plants. I will kill them. So I mainly study environmental occupational health from an epidemiology but community engagement lens. So my primary area of research right now is exposure assessment, particularly with chemicals. So again, I've studied PFAS in Nepal. I'm also working on some pesticide research now, and then some more non-specific broad exposure assessment planned for Guatemala. Two really important aspects of my work are engaging with the communities. So the cohorts I work with are very involved. The first cohort I worked with in Nepal was the best research introduction ever. Everybody's super engaged, super interested. There's a whole WhatsApp group. So that was a really great introduction to how the community can be really engaged in this type of research. I'm currently doing a postdoc at the University of Michigan, and my postdoc is very focused on integrating mixed methods survey methodology into the biomarker analysis that my background has been in. So I wanted to start off with an example. I have a One Health lecture every year for my students, and this is how we start off. Usually I make them tell me the animal, the people, and the environment part, but I won't make everybody do that. So I wanted to talk a little bit about dengue virus because this is something that's endemic in Guatemala. So dengue is a mosquito-borne disease, and it's actually the most common mosquito-borne disease. So mosquito bites an infected person, mosquito bites someone else, transmits the disease, and then the cycle continues on. So I think a lot of times when we talk about One Health, we really understand the people part, we really understand the animal part. We kind of forget about the environmental part. So here we have the mosquito is our animal, the people are getting dengue, but a lot of the environmental factors impact this as well. So, for example, flooding is something that would really impact the quantity of mosquitoes in an area. And we see that often flooding the rainy season is what leads to higher cases of dengue, especially in Guatemala. So again, today I'll really be highlighting the environmental part of One Health. I really liked this graphic because it groups the plant health with the animal health and not with the environmental. Um, so I thought that was an interesting way to do it. But I think it's really interesting to think about all the ways that the things we do as people impact our environment. So a lot of zoonotic diseases are due to changes in our environment, to human-caused climate change, and to things like chemical pollution, which is constantly evolving as we're kind of inventing new chemicals. So back to the dengue in Guatemala example. So dengue is the most common mosquito transmitted virus in Guatemala. And the highest transmission rates do occur during the rainy season, which is June to August, which you'll note when I talk about the clinic timing later, that is the timing of our clinic as well. So in 2024, there was a massive outbreak of dengue in Guatemala after a really heavy rainy season. You might remember seeing like images of flooding in Guatemala on the news. It made like international news that year. So there was a huge outbreak of dengue. And then in 2025, cases went back to kind of the average number of cases of dengue. So they decreased by almost 70% back to the normal amount. But even at that level, there were still more than 18,000 cases in Guatemala by summer. And then in general, Honduras and Guatemala are reporting the greatest number of cases of dengue in Central America on an annual basis. So I get really excited whenever I see any public health announcement everywhere. So my phone is full of these pictures. But this is from our clinic, the community center we were at in Alatenango. And this is during 2024 when there was that big outbreak of dengue. And so these signs are kind of explaining symptoms of dengue, when you can just kind of rest and do kind of supportive care versus when you should seek medical help. And then the one that's pretty small, and I don't know if you can see my pointer, but the one on the top right of the door. That one I was really excited about because that one is talking about how to mitigate mosquito egg-laying environments around your house. So pouring out standing water, making sure gutters are not clogged up with water to reduce the amount of mosquitoes. So I thought that was really cool. It's really, really highlighting the environmental aspect of dengue in Guatemala. Another just kind of sidebar from last year is that screwworm has become a big concern in Central America. And so these flyers were in our clinic location, a community center in San Vicente Pacaya in Guatemala. And so screwworm is this parasite that primarily infects livestock, and it can lead to infections that can ultimately lead to permanent injury, disability in livestock, or death if they aren't treated. And so this is something that I think really just kind of makes you think about how connected all of our environment and health really are, because screwworm no longer exists in the United States. It was eradicated in 1966 by releasing sterile flies that mated with the non-sterile flies and eventually kind of caused the disease to die out in the US. But it's been moving steadily north with climate change. And so screwworm is something that's now becoming a concern again in the US. And there were cases last year within 70 miles of the US-Mexico border. So health departments in Texas, Louisiana, Florida are having to think more about this and how to prepare for this with climate change. So I want to just briefly highlight some of the environmental health challenges that Guatemala faces. I do want to highlight these aren't exclusive to Guatemala. These are environmental health challenges we face everywhere. So air pollution in Guatemala is 4 times higher than the WHO air quality guideline for PM 2.5 for small particles. And also 51% of the population does not have clean fuel for cooking. So this means that there are a lot of like indoor cook stoves that lead to inhaling a lot of smoke in the living area. And this type of air pollution can lead to increases in deaths from stroke and heart disease. So Guatemala doesn't currently have legal standards for PM 2.5, but there has been progress on creating a national policy for household energy. As far as water quality, 44% of the population of Guatemala does not have access to safe drinking water. It's estimated that 95% of surface water in Guatemala is contaminated and not safe for drinking. And then 47% of deaths from diarrheal disease in Guatemala are caused by unsafe drinking water and inability to perform kind of adequate hygiene measures. So, as Janet mentioned in her talk last month, People and Pets goes to Guatemala once a year in June to run a One Health clinic in rural communities in the central part of Guatemala. So, these clinics are similar to the clinics in Georgia, where there's human healthcare available and veterinary healthcare. So humans come, these clinics provide basic healthcare and kind of well checkup services for people, blood pressure, basic screening for diseases, occasionally referrals to other resources in the community. And then at the same time, there's also a spay and neuter clinic going on the other side of the community center that's spaying cats and dogs that people have brought in. So this is kind of how I came to People and Pets. I very randomly heard about the trip from a friend of a friend, ended up going to Guatemala, and kind of never left. So what we've been doing now, last year, I started thinking about how can we get the environmental part more involved in this already really great One Health model that's already covered people and pets. So last year, me and then Aisha Shah, who's one of my colleagues at the University of Michigan, she's a doctoral student, we conducted this needs assessment with people who are already attending the clinic. And we talked to them about their environment, their understanding of climate change, their concerns. And I'll talk a little bit more about that on the next few slides. So taking the information we gained from that, we then partnered with Universidad Rafael Landivar in Guatemala City. And we have collaboratively been designing a study over the last year to work to address some of those environmental concerns that were raised by community members last year. So this year, and I'll talk a little more about this later as well, but this year we'll be conducting an exposure assessment where we'll be conducting a formal survey with particularly women attending the clinic to assess their burden of environmental exposure and how that might impact their health outcomes related to their mental health and levels of stress. And then we hope to continue this community partnership using the results of this survey to highlight where the environmental gaps and needs are in the community and to guide our future research and interventions in the community. So I've mentioned a few of these, but I wanted to highlight how interdisciplinary this collaboration is, because that's the part of One Health I really love, is that there's a place for everybody to fit. So I work with the Center for Global Health Equity and the Survey Research Center at the University of Michigan. We're working with People and Pets Project. And then this year in Guatemala, I'll be working with Dr. Erin Cameron, who is a clinical psychologist and works in urban planning and architecture. And so she'll be helping with the mental health outcomes. She studies primarily how heat and climate change impact women's health in informal settlements in South Africa and Brazil. So very excited to have her bring in that perspective. And then additionally, we're working with Universidad Rafael Landivar in Guatemala City. We're working there with 3 researchers from health sciences and urban planning. So kind of bringing together these areas we wouldn't think go together, but they all kind of overlap in this One Health sphere. So in 2025, as I mentioned, we conducted these semi-structured interviews with 75 community members attending the clinic in Guatemala in San Vicente Pacaya. So we had some basic questions addressing water quality, air quality, and climate change. So whether people had heard of climate change, whether or not they thought it was relevant to them, how they thought it affected them. And then also we just asked people about where do you get your water? What have you noticed about your water? Do you think there are problems with your water, things we could improve? The same thing for air. What air quality of issues have you noticed in your community? What do you think needs changed, improved? So we spent time with community members writing down their responses to these questions, and then we looked for kind of patterns and trends and things that came up over and over in this community. So what we found is that more than half of the people who participated in our survey mentioned water contamination as an issue they thought was really important in the community. So there were issues reported with the clarity of the water, the odor, and the color. And so this is both water for drinking, but also for laundry, for household use, for other things. And then if you look at the pie chart on the bottom right, we asked people, where are you primarily getting the drinking water that you drink? And so most people are buying 5-gallon jugs of water from a truck that comes to town, and they're using that to drink. And so this is filtered water. So that is a safe source of drinking water, but it does rely on kind of this transportation chain, bringing water into community, buying that water, taking it home, instead of just having it available from the tap like so many of us have. A smaller group of people were using well water. Some people are using surface water. A few people do have municipal water, so piped into the house from a city supply. And then about 16% are using a point of use filter. And so the most common type of filter we saw were these clay filters that people have in their household, and you filter all the water that you're going to drink through that. Those last, depending on the quality, a year, 2 years, sometimes a little more. So that is a resource that's really useful, and a lot of NGOs do like provide that type of resource, but it is something that requires this maintenance over time as well. So just a consideration. Something also to note is that most of the people attending our clinic are women, almost 80%. So we spoke to some men as well at the clinic, but the overwhelming majority are women of all ages. Of the people we talked to, 70% said that they believe that climate change is responsible for changes in the quality and availability of their water supply in their community. So climate change was something that people were aware of and had opinions about. In addition to those beliefs, people highlighted both drought and flooding as environmental concerns, and especially changes in the seasonal patterns of drought and flooding in Guatemala. Some of the other concerns that our participants highlighted were the presence of insect larvae in the surface water, especially, while also getting into storage tanks for drinking water. Some of these larvae are likely mosquitoes, and then someone brought us some, and it was a fly larvae as well. So this is an issue with water safety as far as like mosquito breeding, but also this makes water like unappealing to drink for people. Something that was really, really commonly mentioned as an issue impacting community air quality was burning trash. And so almost everyone said burning trash is what we do in this community. This is how we take care of this trash that we have. And when there's not really another method to dispose of it, it makes a lot of sense why you would burn it to get rid of this, so it's not in the street. Another interesting point was several people mentioned that there was a newer geothermal power plant built near the community, and they were concerned that there was a strong smell like sulfur that regularly came from that power plant. So this one was something we thought was really interesting because this power plant had been built really, really close to some of these people's homes, less than 400 meters in some cases. But residents weren't really informed about it. The power plant was funded by a company that's not from Guatemala, it's from overseas. And so residents weren't really involved in this process. And we found that they were there was a kind of a knowledge gap of what this power plant was actually doing, whether it was helping the community or hurting the community. And then these concerns about the sulfur smell weren't really explained or addressed to community members. So, taking all of this information that we learned from the community last year, we started to think about what can we do this year to address the environmental concerns that were raised. So we decided that this year we're going to focus on surveying exposure burden, exposure history, and mental health. Because mental health is something that's often raised by women attending the clinic, but there are very limited resources for mental health in Guatemala. So we want to gain a better understanding of the environmental and psychosocial stressors that women in these communities are facing. And so, kind of across the board globally, women do experience higher rates of environmental and psychosocial stressors generally. So, women are usually the primary caregiver for the family and generally the main provider of fuel for cooking, food, and water resources for the family. Women, and especially rural women, are predicted to be disproportionately impacted by climate change because of these relationships, and often because they have limited access to economic opportunities outside their home or local community, but are doing a lot of this unpaid labor that families depend on. Additionally, as I mentioned in Guatemala, there are very low rates of access and availability of mental health services in these communities to address any psychosocial stressors that may occur. So, to focus on these issues, this year we plan to enroll 150 women that are attending the clinic ages 18 to 65. And we plan to conduct an exposure assessment asking about their exposure history with specific air, water, and climate issues. So we'll ask again about issues in the community they see impacting their air quality, their water quality, their climate, any specific concerns about things they're exposed to. We'll ask about some occupational characteristics. Guatemala is highly agricultural, so 30% of people work in the agricultural sector. So there's some concern there for pesticide exposure. People work in industry as well. There's a significant mining industry, so some exposures there as well. And we'll also ask about housing characteristics. So what type of house are you living in? Do you have access to things like air conditioning when it's hot? Is there running water in your house? Is there screens on the window to prevent insects from entering? So things like this that sit kind of at the intersection of environmental and human health. So we'll also use some standardized tools. So we'll use the Household Water Insecurity Index to ask about how often people have experienced water insecurity in the past year. We'll also screen for depression, anxiety, and sleep quality. So these screens are very similar to when you go to the doctor's office. They hand you the papers when you go in, you check off your symptoms. Same screening, but validated in Spanish, particularly Colombian Spanish, so similar to Guatemala. And then we'll also conduct 2 saliva swabs to look at 2 biomarkers. So we'll look at cortisol as a biomarker of stress and immunoglobulin A as a proxy for potential immune outcomes. So this will hopefully help us link environmental exposures and how many exposures people are reporting, the degree of exposure they're reporting, with their depressive and anxiety symptoms. And then these biomarkers will help us to better quantify that relationship. So outcomes we hope to achieve throughout this project. Firstly, we'll report our results back to the community. So this is something that's very important to me in research. I think historically in academia, a lot of times the results kind of stay in the papers in the scientific community. And I see especially public health as a really useful field for the community that we're studying. So this data belongs to them, it came from them. And I think it's very exciting for people to see the data and understand the data and actually get to use it. And the local community is often the one who will lead change. And so this gives them a tool to do so. So we have some local partners in the news industry in Guatemala and also social media. So we'll use those avenues to report our results to the community. We also plan to create two clinical intake toolkits. So one for environmental determinants of health and one to assess water insecurity. So these will be made available to community providers, and then we'll also have them available at future people and pets clinics in Guatemala and potentially in Georgia as well, where other environmental issues exist. Another thing I'm very excited about is just building these university collaborations with University Rafael Landivar and training students. So we'll have 3 to 5 students from Guatemala City joining us in Guatemala this summer to conduct our surveys. And then we have a data analysis team of students here at the University of Michigan and then at University of Sao Paulo in Brazil. I'm very passionate about training students in this area, especially because in public health and schools of public health, I feel like EHS is always the small department. And so any chance to bring people into this area and get them excited about the environment is great. So in the future, um, first of all, something that's already happening is we're already conducting a similar needs assessment to the needs assessment we conducted in Guatemala last year in the people and pets clinics in Georgia this year. So this is a project I'm working on with Mercer medical students and UGA veterinary students. So they'll be conducting this survey with people attending people and pets clinics in Georgia over the next few months, asking again about their mental health, their environmental exposures, and particularly how their interactions with their pets have changed or shaped their health outcomes. The research we do in the future in Guatemala, I have some ideas of things I'd like to do. I'd really like to study the personal care products people are using because those are not as well regulated in a lot of parts of the world. And I'd also like to do some individual monitoring using wearables to understand for sure like what the specific exposures of people are. But any future research we do in Guatemala will be really directed by the data we gather and then needs and priorities that the community highlights to us. So that could change based on what we learn this summer. I really like this One Health diagram that I've included on this slide because this one really highlights how people in the environment, animal health, and people health, human health, can work together, coordinate, communicate, and collaborate to achieve better health outcomes for all 3 areas. And I think it's really important to make sure that all 3 areas are representative and working together. And there are all these very cool interdisciplinary collaboration opportunities within One Health. All right, and here's our team from Guatemala last year. So I'll be seeing a lot of people in this photo again soon in June. But thank you guys for listening. And if there are any questions, I am happy to answer those for you.
Thank you so much, Dr. Ward. I appreciate it. While people are thinking about their questions, I do have a couple that kind of came to mind. I know you just mentioned that in the Georgia clinics, you'll be looking at animal interactions with the humans, in addition to the human and the environmental components. In the Guatemala survey, are there any questions about animal interactions there?
There are not this year because we are trying to use questions that have been used in Spanish-speaking populations before so that we have some comparable data. But I think if these questions provide useful insights in Georgia, that would be something we would really like to look at next year as well.
Yeah, that's really cool. Well, I have to say, I do a lot of research in Nepal as well,
Oh,
so
wow.
that was really cool to see that you have an interest. And I actually looked at depression and anxiety post earthquake in Nepal, and
Okay.
then another measure we did looking at mental health outcomes was actually resilience. And there's a brief resilience scale well that may be really cool to implement in Guatemala as well. So really cool research, and thank you for tying it back to Georgia as well. It seems like there'll be a lot of interaction in terms of figuring out how to see benefits in multiple communities. So thank you. Just wanted to open the floor to more questions.
Good afternoon. This is Dr. Samples and Dr. Ward. That was an amazing presentation. It was really interesting. But I did have number one, the collaboration that you have there proposed with Mercer School of Medicine and the Georgia Vet School up in Athens. That is going to be an amazing collaboration, I can tell you. I mean, that really is going to be amazing. But I did have a question as far as Guatemala. Um, what is there? Do they have the same ideas on pets that we do as far as family dogs, family cats, etc., that are in the homes, or what animal in, I guess, environment, for lack of a better term, would be looked at in that? Is it more the wildlife, or is it companion, or both, or even the agricultural animals?
Yeah. Oh, so first of all, I've really been enjoying the collaboration with the Mercer and UGA students. They're great. They're really enthusiastic. I actually just was in Georgia 4 weeks ago, 3, 4 weeks ago. It's been a while now, but I got to visit with all of them, attend one of the clinics. Um, and so that was a really great time. I've really enjoyed working with them. I always enjoy working with students. They're so enthusiastic and happy and excited to learn. Um, so in Guatemala, I think there is some overlap in how pets are viewed. I think especially cats are more viewed as kind of indoor animals. I do remember 2 years ago, there was this little girl. She brought in her little kitten, and we were giving her discharge instructions in the veterinary clinic, and they were like, "Don't let her outside in the dirt." And she was like, "No, no, this is a princess. She never touches the ground. She sleeps in my bed." So that's how I treat my cats too. So there is a lot of that. I think with dogs, there are a fair amount of strays that you'll see as well. And I'm sure stray cats, they're just better at hiding. Um, but with dogs, there are a fair amount of strays in the communities, but there are also household pets. I would say it's more common than here to have kind of an outdoor dog that's allowed to roam a little more freely. So I think there is an overlap with the view of pets, but there is also kind of this bigger, more visible stray animal problem as well.
Thank you.
Any other questions? I think Janet had to hop off, but I did want to echo that last month she said, to definitely reach out to her via her website, the People and Pets Project, and if anybody's interested in collaboration and learning more about this trip to Guatemala. So.
Yes, for sure. We have people from all over the country now, California, Georgia, Florida, Indiana, Michigan, joining us. So there's the whole veterinary team, human health team, and then hopefully we'll have an environmental team now too.
Very cool. Okay, well, great. Well, thank you again, Dr. Ward. Just so appreciative that you spent time talking to the Georgia One Health Consortium today. And we wish you best of luck on your project this summer, and continue to follow for updates. So thank you again. I appreciate it. I hope everybody has a good day.